Hey guys, I'm Pete Ellingson. I'm personal trainer and nutritionist with Epic Body Designs. I'm working today in conjunction with Dina Jackson. She's a registered shiatsu therapist. Very experienced, very trusted. I've had her work and she's very good. We're going to be addressing lower back pain and lower back issues in this series of video logs. As we get started, I'd like you to be aware of going in, making sure that you get the proper tests done to make sure there's no herniated discs or any degenerative disc, anything that's serious structural to be taking a look at. Today our first video, we're gonna be addressing stabilization of the lower back. We're gonna stabilize all those vertebrae down through the lower back to make sure that you don't get damage, or if there is any kind of damage, it's not gonna make it aggravated. What we're looking at today is basically like a weight belt. When you go to the gym and you see the guys doing powerlifting or fairly aggressive exercises, heavy weights, and they've got the belt on to keep their lower back safe and stabilized, what most people don't realize is that we actually have our own natural anatomical weight belt. It's a muscle called transverse abdominis in conjunction with various other stabilizer muscles. It will work together to keep that lower back nice and aligned as you're doing more aggressive exercises, twists, maybe in your golf, hockey, whatever sport you decide to play, or even in the gym as you're working out. So what we want to look at is engaging the muscles that are right here on the sides of our body, because what happens is we have a connective tissue called fascia that runs across from these muscle to muscle, and then through the back to the spine, and it wraps all the way around the body, just like that weight belt. Then when we engage that and lift the pelvic floor, all the muscles of the pelvic floor, we're going to be drawing those up. When you do that, then all the stabilizer muscles automatically fire along the spine. So they all work together, keeping that lower back safe, right? So I'm just going to show you on my own body here. If you want to follow along in this exercise, what we're going to do, we're going to let our body weight rest on our arms. Just let yourself sit your hips back, put your weight into your arms and just hold it there. So start off by breathing in, let your belly expand. Breathe out, and as you breathe out, you're going to draw that belly button all the way back into the spine, like that. Breathe in, let it expand. Now be aware of these muscles on the side as you draw it back and you're breathing out. It's going to be drawing that back in towards the spine. And what I want you to also be aware of is that you're not actually using these muscles, the rectus abdominis, because what those muscles do is they pull you forward. This muscle here is going to pull that stomach in. These muscles are going to pull you forward. What happens when you use these muscles, your anatomically straight back should have this little dip here in the lower back. When you use these muscles, you're going to lose that dip. So as I contract those muscles, see it? There it goes, straightens out the back. We don't want that. We want it to be anatomically straight. So a natural little curve. Therefore, it's going to be these muscles drawing in that belly button towards the spine. Letting these just be engaged. Then we can continue with this exercise in this posture. Breathing in, breathing out, feeling those muscles contract. Now I'm going to get you to keep that in, belly button drawn in towards the spine. Continue breathing. You're going to lift the pelvic floor at the same time. So breathe and be aware of that, the effort that's used in the contraction of those muscles as you're breathing. You're also going to be aware of the compression that happens in your abdominal cavity. It's really good for you, actually. The blood flow, everything compressing and moving through there. Very healthy for you. But what we're looking at here is the stabilization. So we're going to keep in that engagement of those muscles. and thinking engagement, because when you engage, rather than thinking of a contraction, it's the engagement on par to the intensity of the exercise that you're doing. The more intense the twist, the swing, or whatever it is you're doing, the lifting, the heavier the weight, the faster you're moving, the more you want to engage. So it's on par. Engagement, intensity. Now if you want to go ahead and move around, keep all those muscles drawn in, engaged here, drawing up the pelvic floor, and just move around and see how it feels. Breathe, continue breathing. Just be aware of those muscles. So now when you're exercising, that same awareness, feel those engaged. Keep your back safe. We look forward to seeing you in the next video. Thanks a lot, guys. Have a good day.